ADHD and depression can look a lot alike. Fatigue, poor motivation, difficulty concentrating. But the way I think about treatment is completely different. My name is Jonathan Murphy, psychiatric nurse practitioner, and I've been treating adults with ADHD for a decade. Today, we're going to be using the emotimeter to check the emotional temperature of a few test subjects. And by the end of this video, you'll know exactly how I approach these situations as an ADHD prescriber. And by the way, this isn't individual medical advice. Talk to your prescriber for that. Now let's get into it. It's time to check in on our first test subject. They've been on ADHD medication for 1 month. Focus has improved, but their emotional temperature is running cold. The ADHD medication has slightly lifted the fog, but something is still missing. Here's what I do in this situation. Once ADHD medication is largely dialed in, if fatigue and low motivation still persist, I will add Wellbutrin XL 150 milligrams. This is going to target those depressive symptoms, providing a therapeutic combination to the ADHD medication. If there are any low libido issues or sexual side effects from any other medication, it will give those a bit of a lift. Now let's check on another one of our test subjects. They were quickly scanned by the patented D-Ray, which confirmed accurate ADHD diagnosis. However, it was noted there were depressive symptoms present on intake. The starting point was to treat ADHD symptoms aligned with the patient's stated preference. But let's take a look at that emotimeter. 3 days into treatment, this happened. And here's a rule of thumb. If someone started ADHD medication and they notice a distinct improvement for 1 to 3 days, sharply declining thereafter, that means we're dealing with a depressive cloud that's holding back the ADHD medication, and I know nothing will improve without another medication on board. And this is the point in our broadcast where I'm going to direct you to the SSRI showcase. First line options are usually Prozac and Lexapro. Strong evidence base, simple dosing regimen. What I typically do not use, Zoloft. Why? It works great for some. I'm just being real with you. Every prescriber has their own toolkit, and sertraline never made it into mine. And we're navigating insurance also. I know that Prozac, otherwise known as fluoxetine, and Lexapro, otherwise known as escitalopram, are adequate options for insurance, which sometimes open the door to newer, more novel and effective options, my two favorites being Vibrid and Trintellix. They're new, they work well, and they're very expensive. But if it works for you, then it might be worth jumping through those hoops. Then we got the SNRIs, Prestige, Effexor, Cymbalta. I use these less, but they can be effective for severe anxiety, but they can also cause brain zaps. And if you know, you know. It sounds like the emotimeter is telling us something new. Look at that. Lexapro 10 milligrams, 2 weeks later, that ADHD medication is working pretty good. We're going to check out just one more test subject. Oh dear, the emotimeter is not looking very good. Dark thoughts, severe depression, irregular mood swings. But when I see this type of symptom severity, I'm not thinking SSRI. Oh no. In that context, I'm thinking stabilize the mood. I usually reach for lamotrigine and Lamictal, but if you want to hear more about this topic, I made a video about ADHD medication and bipolar disorder. You can check that out. Link in the description. Here's the thing about all of this. If your emotimeter is reading way down there in the cold zone, you're not going to get to just right with ADHD medication by itself. You see, medication does a great job of managing things internally, but for the full picture, you got to navigate the world externally. And this process is best understood through talk therapy, relational issues, patterns you had since growing up, group psychology. It's the stuff they don't teach you in school. It really is the big picture. And that's exactly why I created the survival modality framework. If you understand the patterns your nervous system is still running, exactly why your body responds the way it does in certain situations and circumstances, that understanding leads you out of survival mode. And if this resonated, you can go ahead and check out the survival modality playlist. This video will give you a roadmap. You can check it out right there. Drop a comment. Do you deal with ADHD and a depressed mood? What worked for you? I want to know. And go ahead, hit subscribe if you want to keep receiving practical strategies from a nurse practitioner who won't sell you short.